Good afternoon, good evening. Thank you so much for joining us for the Mpox special briefing from AfricaCDC. My name is Margaret Edwin, the Director of Communications. I will be moderating this session. Joining us today is the main speaker, Dr. Jean Kaseya, the Director General of AfricaCDC, and we are also joined by the Director of NPHI from DRC, Dr. Dieudonné Mwamba. I will now hand it over to DG to start the session. Over to you, DG.
Thank you so much, Margaret, and good morning, good afternoon, good evening, colleagues. Welcome to the AfricaCDC weekly press briefing. As the Director of Communications from AfricaCDC was saying, we are today joined by the Director General Dieudonné Mwamba, who's leading the National Public Health Institute of DRC. I'm taking this press conference from DRC because we know this disease X in DRC, and I landed to see what kind of support AfricaCDC can provide to DRC. This one we'll discuss after the some highlights regarding Mpox. Let us start with the first slide. That is giving us a new update from the region. As you know, we have 20 countries affected since January. And we also know that the clade 1B was confirmed in Zambia and Zimbabwe. We know, based on effort that AfricaCDC is doing, we know that there is what we call the decentralization of the surveillance and the testing. You will see that the testing rate is not ideal one in DRC, where we have a number of cases. In total, for the week 47, we got, unfortunately, 2,700 new cases. And if you compare with the previous week, we had 2,680. It means the trend of the outbreak is still growing. In total, we have 62,171 cases. Even in terms of deaths, if you compare, in terms of confirmed cases, if you compare the previous week and the current week, we see there is an increase. And we are still losing people. Last week, we lost 36 new deaths, and that is bringing a total of 1,200 deaths since January 2024. I wanted also to flag to you that if we compare from the first week, it means the 1st of January, to the week of the last week of November, this is the AP week 47, we have an increase of more than 716%. With this trend, if we continue like that, for sure, end of December, we'll have more than 800% of cases comparing to 2023. We also know children are are mostly affected, and this percentage is changing every week. And we also know now, based on the evidence that we have, there are more female than male affected. Next slide, please. We wanted to show you, when we say there is a difference between 2022, 2023, and 2024, just have a look on this presentation. You'll see the trend in 2024 being more than 372% if you compare with the same period in 2023. We are facing a major outbreak. And we want colleagues from media to help us, because we see there is a kind of less of coverage regarding Mpox while this outbreak is still moving. This is an evidence to share that after COVID, Mpox is the largest outbreak that Africa is facing. Next slide. When we talk about Mpox, we are familiar with that. We are talking about not one, not two, not three, but 4 different outbreaks. We are talking about clade 2A and B. We are talking about clade 1A and clade 1B. And this map is helping you to know where are all of these clades. Even in some places, we have a combination of clades, like in Cameroon, you have clade 2 and clade 1A, while in Kinshasa, you have 1A, 1B together. And this kind of combination, we have it in a number of places. This is what is making Mpox more complicated in terms of appropriate response. Next slide. Let us have a look on DRC. As I was saying, you see the difference in this graph, the difference between number of cases and confirmed cases. Why there is this difference? Because we have a major issue regarding the lab. And this is why our strategy as AfricaCDC supporting the government is really to decentralize the lab in DRC. Our previous approach of having only the sequencing capacity at national level, having PCR in some provinces as a group of provinces, this doesn't work. This doesn't work in DRC. This is why we are mostly, and it will be a legacy even for the disease X, we'll talk about it, we need to have the strong lab capacity in DRC. And you'll see also the positivity rate is low because of this lab issue, but also the distance. DRC is a big country, but infrastructures are not at the ideal level. We saw from the report that we received, less than 35% of all samples are reaching labs in the 48 hours recommended. It means within the 48 hours, it means we are, even when we receive samples, we are facing the quality of the samples. And this one is a major issue we need to address quickly. Because today we are talking about Mpox, but we can talk about another disease. When I will talk about disease X, supported by the director, you will understand how this one is affecting, because the disease X started in October. We are dealing with that now. It means we need to strengthen the surveillance mechanism and the lab capacity. Next slide. We wanted also to say DRC is not just Mpox. It's also measles and other outbreaks. You can please see the trend here about measles in Equateur, where we have Mpox, and in Chuapa, where we have Mpox. If you see in Chuapa, the number of cases of measles, it's even more than Mpox. We have a major measles outbreak that needs a robust response. This is the same case in Equateur. Reinforcing and supporting appropriate surveillance mechanisms, reinforcing the lab, building capacities of health workers and community health workers, and having the appropriate tools, vaccines, medicines, are critical for us now in DRC and in Africa. Next slide, please. let us talk about the disease acts. Then I will hand over to the director who's with us today. The disease acts started officially on 24 October 2024 in one of the health zones called Panzi in the province of Kwango. Kwango is one of the sub-provinces of Bandundu in the past. Today, based on the report that we received, and the director is having updated figures, we have around 79 deaths out of 376 cases. And you can see the analysis that the team did to show how this outbreak is affecting mostly young people, children. You will see under 5 are mostly affected with a total of 198 cases. With that, I will hand over to the DG, who can give us now an overview of the disease X before moving to questions. DG, à vous la parole, s'il vous plaît.
Should remove.
Merci, Monsieur le directeur général. Donc, au sujet de l'épidémie qui sévit au niveau de la province de Kwango, dans la zone santé de Panzi, effectivement, c'est depuis le 24 octobre que il y a la notification des cas au niveau de la zone santé de Panzi. Et nous, on a eu l'alerte au niveau national autour du 1er décembre. Et aussitôt que l'alerte a été remontée, le COUSP, le Centre des opérations d'urgence, s'est mis en alerte maximale et en collaboration avec la province, donc la division provinciale de la santé et la zone de santé, nous avons dépêché une équipe de la province, donc le ministre provincial de la Santé, pour vous rappeler qu'il a été un ancien médecin chef de zone de Panzi, donc s'est rendu accompagné de 2 épidémiologistes. Et les premières investigations qui ont été faites et la revue documentaire, c'est qu'on a enregistré depuis le 24 octobre 382 cas qui ont été notifiés et 27 décès au niveau des formations sanitaires. Et parmi les 27 décès, il faut noter que 10 sont morts dans un tableau de dyspnée et d'anémie. Au niveau de la communauté, il a été recensé 44 décès communautaires. Alors, ce qui nous donne un ensemble autour de 71 décès, dont 27, comme je le dis, au niveau des formations sanitaires et 44 dans la communauté. Et la plupart de ces patients, les symptômes qu'ils ont présentés, c'est la fièvre, céphalée, rhinorrhée et avec dyspnée. La toux aussi. Alors, les équipes sont à pied d'œuvre. Il y a eu des prélèvements parce que, vous savez, quand on fait face à une maladie jusque-là qui est inconnue, donc il est important que nous puissions prélever et amener les échantillons au laboratoire. Donc, au moment où nous parlons, 5 prélèvements ont été réalisés et sont en train d'être acheminés au niveau de Kikwit, parce que la zone de santé de Panzi, qui est vraiment une zone enclavée, qui est déjà à 470 km du chef-lieu de Kwango, et n'ont pas de capacité de testing. Donc, les échantillons sont en route vers Kikwit pour être examinés. Et nous sommes en attente des résultats de laboratoire d'ici 24-48 heures pour être fixés, savoir exactement de quoi il s'agit. Bien que les premiers constats, quand on voit un peu la symptomatologie et que présentent la plupart des patients, c'est qu'on pourrait penser à une maladie d'origine respiratoire. Maintenant, nous attendons vraiment à voir les résultats de laboratoire pour confirmer le diagnostic et préciser la prise en charge. Autre chose, c'est qu'il y a déjà les équipes au niveau du Centre des opérations d'urgence de santé publique, le COUSP, au niveau de l'INSP, qui est en mode alerte maximale. Et nous avons déjà positionné des équipes du niveau central qui vont quitter d'ici 24 heures pour rejoindre la zone de santé de Panzi pour aller apporter du support à l'équipe provinciale et à l'équipe de la zone de santé pour laquelle nous savons déjà que les capacités de réponse et même des investigations sont assez limitées et nous devons leur apporter ce support assez rapidement. Donc, il y a cette équipe du niveau central qui est vraiment en train de se déployer pour aller apporter ce support au niveau de la zone de santé de la province. Donc, voilà un peu les résumés des informations que j'aimerais donner. Donc, nous sommes vraiment en alerte maximale et nous allons devoir confirmer, avoir le diagnostic, bien que les diagnostics, les suspicions sont autour d'une infection respiratoire. Mais il faut noter aussi que dans la zone de santé de Panzi, il y a 2 ans, ils ont connu une grande épidémie de fièvre typhoïde dans cette zone et que le taux de malnutrition dans cette zone de santé, il est autour de 40%. Donc, ce sont des facteurs de vulnérabilité que connaît cette zone de santé. Donc, le tableau que présentent la plupart des malades actuellement, donc il faut retenir que c'est sur un terrain de vulnérabilité en termes de malnutrition et qui est chronique dans cette zone de santé. Et nous pensons que peut-être que c'est déjà un terrain fragile et que pendant cette période, c'est une période où nous avons une épidémie connue, que ce soit au niveau de Kinshasa et même dans la province de Congo, d'une grippe saisonnière. Donc, nous sommes sur un terrain d'une recrudescence de grippe saisonnière parce qu'entre le mois d'octobre jusqu'à décembre, c'est vraiment la période de la grippe saisonnière. Donc, tout ce contexte est à prendre en compte par rapport à ce phénomène qui survient dans la zone de santé de Panzi. Donc, voilà de manière résumée la situation à ce jour. Donc, les équipes qui sont sur place seront appuyées et dès qu'on aura le diagnostic, nous pourrons mieux renforcer la prise en charge, mieux orienter nos interventions parce que pour l'instant, n'ayant pas un diagnostic précis, il est difficile de savoir ce que nous savons faire à une maladie virale, à une maladie bactérienne, mais nous pensons, nous espérons que dans les 24-48 heures, le diagnostic de laboratoire pourra vraiment nous orienter. Merci.
Margaret, thank you to the DG for the briefing. I have to say, at personal level, 20 years ago, I was leading a health zone close to Panzi. I know this region. I know the challenges they are facing. And I think we are here to support DRC and to understand what is going on. Is it a new disease unknown, or it's something that we know, but we want to know what is it exactly? I think this is what the DG said, ongoing testing will help us to understand what is the issue. Then back to you for questions from journalists.
Thank you, DG. Let's take the first two questions from the chat room. The first question asks about the strides that are being made in the clinical trials to enhance new vaccine development for the prevention of Mpox. That's the first question. The second question is about the unknown disease in DRC, which I think has already been addressed. Let's take this one, which asks how many deaths in regards to the unknown illness, and what is the cause that has come to light so far? So those are the first two questions. I'll hand it over to you, DG, for the first one, and then the director can take the next one. Over to you, DG.
Thank you so much. I think we had some network issue, but I got the first question. It was regarding the clinical trials. Where are we with the clinical trials and for the Mpox vaccine? Then you'll help me to repeat the second one. Regarding the clinical trials, you know, we have 47 studies ongoing currently regarding Mpox. And our director of science and innovation is working with WHO, with CEPI, and all other partners to see how quickly we can confirm. One of the studies is how to use the Bavaria Nordic vaccine for less than 12. Because as you know, we have the recommendation from SAGE, the WHO SAGE, to use that for 12 plus. It means 12 to 17, 17 plus. But now there is this ongoing study for less than 12. We know we have also some other clinical trials for a BioNTech vaccine and other vaccines that are coming. For now, we are moving, but we are not there. I hope very soon we'll get an answer. Regarding the second question, can you please repeat, because we had a network issue?
Yes, DG. So the questions asks about the mystery illness and how many deaths have been recorded so far, and what exactly is the cause that is in terms of the development that is happening at the moment.
Okay, for that, I think the director said, based on the report that they have, 71 cases, deaths out of 382 cases. And I think what is going on, we just have the symptomatology of these cases, but we really don't know what is the cause of that. And for now, based on the guidance from DRC, we cannot speculate on what is the cause of this disease X. But I think the director can come back to give more information when we will have, you know, the outcome from the lab. Over to you.
Thank you, DG. Let's check the next two questions from the floor. Helen from Stats, you have the floor.
Thank you very much. There was a problem with the translation at a point, and so I'm afraid I missed quite a bit of what the Director General from DRC said, and I apologize if I'm asking a question I should already know the answer to. Is it possible that this is not a single outbreak? There was a reference to the fact that there's seasonal flu in that area, and many of the affected people are quite young. It wouldn't be surprising to see a high attack rate for seasonal flu in young children. And there was also a mention earlier of a large measles outbreak in parts of DRC, although I think a different part of DRC. I mean, is it possible that what is being reported here is a mixture of conditions, not a single condition? Thank you.
Thank you. Over to you, DG. The director.
Oui, je pense que je lis effectivement, on a constaté que la maladie touche, effectivement, la majorité sont les jeunes, c'est les enfants de moins de 5 ans qui sont les plus affectés. Et que, comme je l'ai dit, dans cette région, il y a déjà eu par le passé, il y a 2 ans, une épidémie de fièvre typhoïde qui a été dans la zone de santé et que par rapport à la symptomatologie qui se présente actuellement, nous pensons à est-ce que ça peut être les premiers diagnostics nous amènent à penser à une maladie d'origine respiratoire quand nous voyons la symptomatologie. Donc, c'est plus quelque chose de maladie d'origine respiratoire. Et je l'ai dit, que c'est une période où nous avons une recrudescence de cas de grippe saisonnière. Donc, ça, nous le savons, le contexte épidémique dans la région, dans cette zone de santé, que c'est une période où il y a une recrudescence de cas de grippe saisonnière. Mais maintenant, par rapport au phénomène qui est en cours, nous attendons, comme je l'ai dit, les résultats de laboratoire pour être plus confortable, avoir un diagnostic de laboratoire pour être sûr est-ce que c'est une grippe, c'est quel type de grippe. Donc ça, c'est ce qui est en cours et nous espérons que d'ici les prochaines 48 heures, nous serons fixés pour pouvoir avoir un diagnostic à être fixé si c'est effectivement une grippe saisonnière, une maladie virale ou bactérienne. Et là, on pourra mieux adresser la réponse. Merci.
Okay, back to you, Margaret.
Yes. Thank you very much. Let's take the next question. Gabriel Emmanuel from NPR, you have the floor.
Margaret, you can hear us?
Yes, DG, I've handed the floor over to the next question. Gabriel Emmanuel, you have the floor.
Hello?
DG,
Hello?
I can hear you. Can you hear me?
Okay, sorry, it was from my side. Okay, please go ahead.
Yes. Gabriel Emmanuel from NPR, you have the floor. Gabriel, can you hear us?
Are you able to hear me?
All right, yes, we can hear you.
Oh, wonderful. I'm so sorry. I also missed a lot of the translation, so forgive me if this has already been answered. But did I just hear that we should have answers within about 24 hours for the laboratory results for this unknown disease? And also, I'm wondering if the cases have continued. The press release I saw most recently kind of ended at with cases ending at the end of November. I wanted to see how things have continued in the most recent week. Thank you.
Thank you.
Thank you. Let's take.
Yeah, please go ahead, Margaret.
Yeah, let's take the next one from Carmen from Politico. You have the floor.
Thank you so much, Margaret. I just wanted to clarify one thing about the testing. So the testing that the DG is talking about, is this the first testing of these cases, or have there already been some tests that already ruled out some potential diseases that we know about? Thank you.
Thank you. Over to you, DG, for the second one, and then the director can take the other one.
Yes, I think the first one is about the outcome of the testing for the disease X. Yes, as the director said, we are expecting that in the next 24, maximum 48 hours. And this is why we are in DRC. We are sending a team of epidemiologists, lab experts, and IPC, infection prevention control, to fly to Panzi with the government. They will fly tomorrow. Then they will assist from Panzi, but also from Kikwit on the way everything is going. And we want to know very quickly what is it, this disease. You have to know that today the world is wondering. We are getting so many messages about what is going on in DRC. I think before I fly out of DRC, we'll communicate on that. We'll know what is going on. We want also to reinforce the surveillance. I think, as you saw, this disease started on the 24th of October. It's just the 1st of December that the national level was informed about it. It means we have a delay of almost 5 to 6 weeks. And in 5 to 6 weeks, so many things can happen. This is why we are supporting the country to build strong capacity on surveillance. This is just one outbreak. We have a number of other outbreaks, maybe not notified, and people are dying. I think we are taking this very seriously at our level, and our discussions with the DRC authorities, I think, are going very well, and we'll be able to communicate about it. Regarding the second question on the testing, I don't know if we are talking about the testing of Mpox or we are talking about the testing of disease X. That one I didn't get clearly. Are we talking about Mpox or the disease X?
DG, I think the question was on the disease X.
Okay. On the disease X, you know, we collected samples, as the director said. These samples, because Panzi, that is a health district, doesn't have capacity to test, we took the samples to Kikwit. It means almost 500, more than 500 kilometers from Panzi. And our hope, I say our hope, is first, we got quality samples. Second, when the samples will arrive to, will be tested to Kikwit, the outcome will reflect the true reality of what is going on in this region. For now, we cannot comment more. If we comment more on that, it will be just sharing rumors with people. We are led by science. We will wait for tomorrow, at least Saturday, to have the outcome, and the minister, the Director General of NPHI, and myself will communicate on that. Over to you.
Thank you, DG. Let's take the next two questions. The first one asks about the market availability for antibody or antigen-based lateral flow rapid diagnostic tests so as to close the gap in case confirmation and spatiotemporal dynamics monitoring. That's the first question. And the second question asks about how far has Africa gone in the investment in manufacturing of vaccines and medical materials and consumables. Over to you, DG.
Where are we with other activities, PCI, CREC, related to response against Mpox, but also against disease X? We'll talk about it. I think the director is here is not just leading a disease X, is also leading Mpox in DRC. Then it will give us the response about directeur, où est-ce qu'on en est avec les activités de la communication, les activités d'infection, prévention, contrôle des infections par rapport à Mpox en RDC.
Oui, merci pour les questions. Par rapport aux activités de communication et prévention contre les infections, comme vous le savez, en RDC, l'épidémie de Mpox touche toutes les provinces. Donc, toutes les 26 provinces du pays sont affectées par Mpox. Donc, ça vous donne une idée de la grandeur du pays et des défis même que nous avons en matière de communication. Nous avons des provinces qui sont les hotspots, qui notifient beaucoup plus de cas. On les a cités, les provinces de l'Est, l'Équateur, le Sankuru, le sud Ubangi, la Chouapa, la Chopo. Donc, dans ces provinces, nous déployons effectivement des grandes activités de communication, de sensibilisation. Donc, on a eu à faire des points de presse, à communiquer avec les leaders religieux, avec les associations des jeunes. On a fait, il y a des émissions radio, télévision, des affiches. Donc, ces activités se mènent, mais les besoins demeurent énormes parce que, au vu de la dimension du pays, il faut couvrir toutes les 26 provinces. Donc, il y a toujours des gaps en matière de communication qui demeurent. C'est notamment avoir, par exemple, des messages qui doivent être transcrits en langue locale. Parce que à Kinshasa, en RDC, nous avons déjà 4 langues nationales où nous avons traduit des messages dans les 4 langues, mais il faut aller au-delà. Il y a des endroits où il faut mettre ces messages dans vraiment les dialectes qui sont parlés dans ces coins-là. C'est par exemple au Sankuru, il nous faut des messages en langue tétéla. Donc là, et ça, c'est de manière spécifique. Il faut adresser aussi ces messages au niveau de ces populations-là. Donc voilà les défis que nous avons en matière de communication. Donc, il nous faut toujours continuer à communiquer, à maintenir, à intensifier à certains endroits ces messages de communication. Et à d'autres, il faut même ces messages les traduire vraiment dans les dialectes locaux pour que la communication puisse être vraiment optimale dans ces milieux-là. Donc voilà les défis par rapport à la communication. Pour ce qui est de la PCI, aussi, c'est parce que pour la PCI, il y a la PCI, la prévention des infections au niveau des établissements de soins, où nous devons aussi être sûrs que dans tous les établissements de soins, ils ont le dispositif, des matériels des PCI en place en termes des épis, mais tout cela, au vu de la grandeur du pays, les besoins demeurent, c'est que nous puissions rendre disponibles ces équipements au niveau de l'ensemble des provinces et des établissements des soins qui prennent en charge les cas d'Mpox au niveau de CT Mpox, mais pas seulement là où on prend en charge les cas, parce qu'on s'est rendu compte aussi, on ne peut pas, tous les cas ne peuvent pas aller dans des formations sanitaires. Et il faut imaginer aussi des dispositifs de PCI au niveau communautaire pour être sûr que même là, on arrive à contrôler les infections au niveau communautaire. Et là aussi, on a des défis d'avoir des dispositifs de PCI au niveau communautaire. Voilà.
Margaret, for the second question about how far are we with the local manufacturing of diagnostics, vaccines, and therapeutics, I think we are communicating on that. We are working to make sure that Africa can manufacture all of these medical countermeasures. For the Mpox diagnostics, I think we also, the statement made by AfricaCDC regarding this diagnostic coming, the qPCR test kit coming from Morocco. Regarding the vaccine, as you know, we are working for the tech transfer, and there is an ongoing process. It takes some time, but we are moving. In terms of medicines, as I said, we have 47 studies, ongoing studies. Some of them are related to some therapeutics, because tecovirimat was not found useful for the clade 1B that is affecting DRC and a number of other countries. Once we have some progress, we'll communicate and we'll sensitize our communities to understand that something is moving. Back to you.
Thank you, DG. There's another question in regards to the disease X. The question asks, on what basis have the cases been counted? Can you give some information on the case definition that has been used so far? That's the first one. And the next one is on Mpox, and the question is about the numerous overlapping epidemics. Has it been envisioned to deploy antigen or antibody-based testing of Mpox suspect cases so as to use PCR only for confirmation? I can repeat that question. So given the numerous overlapping epidemics, has it been envisioned to deploy antigen or antibody-based testing of Mpox suspect cases so as to use PCR only for confirmation? Over to you, DG.
Okay, I will respond to the second question while the director will respond to the first question related to case definition of X. And I see Dr. Yenyu, who's more expert on diagnostic. Dr. Yenyu, can you please help to respond to the second question because we are connected, and the Director General will speak about the case definition. Over to you, Dr. Yenyu.
Yeah, thank you. Thank you, DG. Thanks for that question. Unfortunately, either antibody or antigen test has not been standardized for Mpox testing in terms of sensitivity, specificity, and so on. So if you see both the AfricaCDC and the WHO guideline, which we jointly published, it does not recommend antibody testing for case identification. It can be used really, to measure the level of exposure because it tells you, past infection. And then for antigen testing, we have been working very, very hard, for evaluation of antigen tests if we can get some sensitive antigen tests. But so far, we don't have really, very good antigen tests with good sensitivity and specificity. So far, what we have is, with sensitivity of 30%, which is very, very low. So that's why, if we see our list of recommended PCR tests, so it doesn't include antigen testing because we didn't have really, quality antigen tests. And the search is continuing. There are some companies still developing, and we will help them to evaluate. If you find a sensitive test, so we'll introduce into the program. But so far, there is no any recommended antigen testing. Thank you.
Thank you, Dr. Yenyu, and thank you, Margaret. Before giving the floor to the Director General, I saw also a question regarding why do these numbers differ? I think we already said we have a major problem in terms of surveillance. And the director will talk about the case definition because that one is leading for some confusion that we have. We are saying things openly based on the information we are getting. And we are so glad that DRC is also applying the transparency. 71, 79, or more than that, we are working with our epidemiologists to see what is exactly, based on the case definition, what is exactly the magnitude of this phenomena. And we'll communicate on that. Director, for the case definition, over to you.
Oui, en rapport avec la définition de cas, effectivement, les équipes qui sont descendues et qui sont sur terrain, il faut noter que c'est des équipes niveau provincial. Et les premières investigations, ils ont regardé quels sont les cas, la symptomatologie, comment les cas, quels sont les signes fréquents qui ont été présentés par la majorité des cas. Et on a noté que pour la majorité des cas, les signes les plus fréquents qui ont été notés, c'est la fièvre, les céphalées, la toux, la rhinorrhée et parfois la dyspnée. Donc, c'est ça, sur base de ces symptômes majeurs, il y a cette définition des cas qui a été construite et c'est sur base de ces définitions que les cas ont été identifiés. Parce que On vous a dit que c'est depuis le 24 octobre que le phénomène est en cours au niveau de la zone de santé. Donc, il fallait avoir cette définition qui est là, mais qui sera améliorée avec les informations supplémentaires, que des investigations supplémentaires qui sont en train d'être menées et que l'équipe du niveau central pourra aller renforcer les investigations pour mieux affiner cette définition de cas. Mais déjà, nous avons une définition de cas préliminaire que les équipes utilisent pour recenser les cas.
Thank you, Director. I think Margaret and the colleagues, for us, we take it seriously. You know, we are following what is really happening. Is it an infectious disease? Is it a non-infectious disease? If we talk about infectious disease, is this a viral infection? Is it a bacterial infection? Is it a fungal infection? Is it a parasitic infection? You know, all of these symptoms are linked to what I'm saying now. Then we don't know. Even we don't know what is the mode of transmission. There are so many things we don't know. And we are there to know, to understand what is going on. Because if we don't know, not only DRC, but all Africa want to understand if we can stop this disease now. I think this is what is our major priority. As it was the major priority for Marburg in Rwanda, it's a major priority now for us to understand what is going on in DRC and how we can stop that. I think the director gave a case definition based on the symptoms that we have currently. As I said, the symptoms can lead for 20 other diseases, but we are focused to understand based on the outcome of the lab what is going on. Over to you, Margaret.
Thank you, DG. Let's take the next two questions. The first one is about Mpox, and it asks, what are the challenges in preventing a resurgence of Mpox for DRC and Rwanda? That's the first one. And then the second one is about the administration of the LC16 vaccine. The question is, why is it too difficult, both before and after the vaccination? DG, over to you. You can take those two.
Yes, I will respond. I'm glad that I've Chanel also here, Chanel leading this component of operations, but I have also colleagues who are from the vaccination pillar. I think Dude will respond to the second one. Regarding the challenges, if I get you regarding the research that are ongoing, there are a number of challenges. As you know, we don't like to talk about the obvious one. People they will say funding, but funding is not the only one, because you know there are some requirements for us to conduct a research project. And we have our team working mostly on to understand, you know, as we did for Marburg, conducted the research to understand that this Marburg came from the bat. Now for Mpox, we want to understand also what is going on. Why would we have the 4 outbreaks? How can we ensure that we will not have the 5th one coming? What is the tools that we can have that can be available for any kind of Mpox outbreak? I think this is what is ongoing. It's so complex, but we are moving. Dude and colleagues who are leading the vaccination pillar, can you please respond to the LC16 vaccine question related to that?
Yes, thank you, DG. Thank you for the question. In terms of the L16 vaccine, the DRC has entered into discussions with the Japanese government in terms of the procurement of 3 million doses. And we are in discussion at this time in terms of the training materials to ensure that this new vaccine is well accepted at the country level. So we are working closely with our CCE colleagues to ensure that we have the necessary documents, the necessary training materials, and also that the messaging is appropriate in terms of our communities. So this work is ongoing. We are discussing again with the Japanese government on how to operationalize this situation. We are confident that we'll be moving forward towards a decision to have the vaccine in the DRC in the next few weeks. But again, the question in terms of the challenges related to the vaccination for this vaccine, we are making sure that the messaging is out. We're making sure that we have the right tools, that we understand the utilization of this vaccine, so that once it's ready here, that the community can accept the vaccine appropriately, and that the uptake is what we expect. Thank you so much, Margaret. Over to you.
Thank you very much. Let's take the last two questions. I have Kiriza online. Kiriza, you have the floor.
Chanel, before that, Margaret, before that, Chanel want to provide to complement what Dude said. Chanel, over to you.
Great, thank you, DG. Thank you, Margaret, and thank you, Dude. Maybe just to complement a response to, I think, one of the specific parts of the question, which was regarding the administration of the vaccine. So the vaccine requires to be administered with a bifurcated needle, which needs to be sterilized. It's not a administration mode that is commonly used anymore, so that requires the training which Dude referred to. And then after administration, the location of where the vaccine was administered needs to be covered and maintained with good hygiene. And so that is also an important part of it. So both the administration and after administration, as the question implied, are really important parts of the vaccine being effective and also safe. So those are going to be important parts of the training if the vaccine is used. Over.
Yeah, Margaret, over to you.
Yes, thank you very much. Let's take the next question from Kiriza. You have the floor.
Margaret,
Kiriza, can you hear us?
Yes, please go ahead.
Kiriza, you have the floor. All right, let's take the next one. Zandile, you have the floor. Zandile, can you hear us? There's a delay. Zandile, you have the floor. Can you hear us?
Margaret, I think Kiriza wrote his or her question because I don't know if...
Right.
Yeah, Zandile, please go ahead, please.
Good afternoon, colleagues. It must have been an error from my side. Sorry.
Yes. We can hear you.
Zandile, you are muted.
Good afternoon. Can you hear me now?
Yes, we can hear you.
I was saying it must have been an error from my side, and I apologize.
Right. Okay. I think, we have the question from Kiriza on the chat box?
Yeah.
If you can see it. Yes.
Okay, I think it's mostly for the director. I will hand over to the director. Director, the question is in French. Kiriza dit il y a un gros problème sur la question de la prise en charge à Goma et Bukavu. Aucune mesure n'est prise. Comment est-ce que la vaccination a précédé la sensibilisation au Nord Kivu? Et pourquoi les résultats des laboratoires prennent, je pense que c'est par rapport à l'épidémie X. À toi.
Oui, par rapport à la première question de Kiriza, peut-être j'ai pas bien des problèmes de prise en charge au niveau de Goma et de Nord Kivu et Sud Kivu. Je ne sais pas à quoi elle fait allusion vraiment c'est quel type de problème, parce qu'au niveau, que ce soit de Goma et de Bukavu, nous avons des centres de traitement Mpox qui sont là, où nous avons, d'ailleurs au niveau de Goma, il y a 3 centres Mpox. Il y a même un qui était initialement utilisé lors de l'épidémie d'Ebola et qu'on a repris maintenant pour aussi Mpox. Donc, le dispositif de prise en charge est là au niveau de ces 2 provinces. Alors, les problèmes, je ne sais pas très bien quand on parle de problèmes de prise en charge, à quoi elle fait vraiment allusion. On sait qu'on a eu quelques challenges de défis pour la prise en charge, c'était avec des complications, parce qu'on a vu certains cas de Mpox qui ont développé des complications oculaires ou même qui ont développé des complications respiratoires. Ça, c'est des problèmes qu'on a eu à faire face, parce que souvent dans certaines structures, c'est Mpox, ils n'ont pas de dispositif pour faire face à ces complications en termes de détresse respiratoire. Et c'est ce genre de problème qu'on est en train d'essayer de combler pour être sûr qu'on a des dispositifs pour prendre en charge les complications, où on a identifié des structures où on peut référer des cas compliqués de Mpox qui ont besoin d'une prise en charge un peu plus spécifique. Donc, si c'est ce genre de problèmes, de complications de prise en charge, peut-être, mais on a identifié des structures pour orienter ce cas-là. Par rapport aussi à la vaccination, pourquoi la sensibilisation n'a pas précédé? En fait, il faut se rappeler que la vaccination Mpox, elle est différente des autres vaccinations qu'on réalise de manière routinière ou en campagne. Ce n'est pas une vaccination de masse, parce que il faut pas l'oublier que cette vaccination Mpox, elle est ciblée. On ne vaccine pas tout le monde comme on le fait avec d'autres maladies. Donc, c'est une vaccination ciblée et c'est une communication interpersonnelle. On va rencontrer les groupes cibles qu'on veut vacciner, c'est eux qu'on sensibilise. Donc, on n'allait pas trouver que c'est une communication, sensibilisation de masse par rapport à la vaccination, parce que la stratégie elle-même, ce n'est pas une stratégie de vaccination de masse. Donc, il faut vraiment faire attention à cela, et c'est pourquoi nous ne voulons pas faire une communication de masse, alors que le vaccin, non seulement on ne l'a pas en quantité suffisante, mais il n'est pas destiné à toute la population. C'est pourquoi nous faisons attention pour que le message de sensibilisation à la vaccination soit ciblé pour les groupes qui ont droit à cette vaccination. Voilà.
Margaret, I think the director provided an appropriate answer for that. Over to you for other questions.
Yes, with that, DG, we have come to the end of the weekly briefing this week. We'll now hand it over to you for your closing remarks.
Thank you so much. I think today we discussed these 2 topics. While we are saying for Marburg, let me start by making it. I got very good news from the US saying that from yesterday, people flying from Rwanda, they will not be channeled to 3 airports as it was the case when we had the level 3 status. I think for now we can consider that all measures are lifted. The level 3 that was downgraded to level 2, and also this measure to channel people only in 3 airports, even if you are going to another state. The second, and we are still waiting for Marburg on, I think next week will be the week of 11 December. We'll be celebrating officially end of Marburg in Rwanda, because it will be 42 days after a confirmed case of Marburg, the last confirmed case in Rwanda. Next week, we hope during our press conference on the 12th, we'll celebrate the success in Africa. Regarding Mpox, we saw that we still have challenges in terms of cases. We still have challenges in terms of surveillance and testing capacity. What we are saying for Mpox is also what's happening for the disease X. We are saying we need in Africa to have strong surveillance system. And this is our business. This is what AfricaCDC must do. Our job to support countries to reinforce, to strengthen the capacity for appropriate surveillance system and lab. How can we accept to have 5-6 weeks of delay? It's just because the surveillance system is weak. You can also see for the lab, we are still waiting to know what is going on. This is why we say we are calling our partners who pledged the resources to support the Mpox outbreak response, to provide this funding for us and countries to build capacities. We don't want to see again another disease that will take 4, 5, 6 weeks before official notification. Regarding this disease X, we say we are waiting for the outcome from the lab, either tomorrow or on Saturday, to know what is going on. If there is any additional support we need to provide to understand the phenomena, we'll do that. But we need to know, to give a name to this disease. That will help us to know how to respond to that outbreak going on in Congo. With that, thank you so much. We hope first to send you a communication by Saturday, Sunday on Disease X. And second, we hope to see all of you on the 12th of December for our next press conference. Good afternoon, good evening to all of you.